Passages I find interesting from War and Peace, part 26. This passage is for my medical health professionals out there, or, just healers in general. They, the doctors, they were of use not because they made the patient swallow drugs, mostly injurious. The injury done by them was hardly perceptible because they were given in such small doses. They were of use, were needed, were indispensable, in fact, for the same reason that there have always been and always will be reputed healers, witches, homeopaths, and allopaths, because they satisfied the moral cravings of the patient and those who loved her. They satisfied that eternal human need of hope for relief, that need for sympathetic action that is felt in the presence of suffering, that need that is shown in its simplest form in the little child, who must have the place rubbed when it has hurt itself. The child is hurt, and runs at once to the arms of its mother or nurse for them to kiss or rub the tender spot, and it feels better for the kissing and rubbing. The children cannot believe that these stronger, cleverer creatures have not the power to relieve its pain. And the hope of relief and the expressions of sympathy as the mother rubs it comfort it. To Natasha, the doctors took the place of the mother kissing and rubbing her boo-boo, when they declared that all the trouble would soon be over, if the coachman were to drive to the chemist shop in Arbatsky Place and buy for 1.70 rubles those powders and pills in a pretty little box, and if those powders were given to the patient in boiled water precisely every 2 hours, neither more nor less. So even Tolstoy recognized back in the day that for some patients, maybe a lot of patients, the pills and the magic potions, etc., isn't what actually helped them. But it was you, the provider, being able to provide them comfort and hope and this feeling like they were doing something for their own health or for the health of their loved one to help them through a very difficult moment or sickness, etc. And I like that. I think it's a good observation and something more providers need to understand, that sometimes you cannot cure people with a pill, but you can cure through just the comfort and hope that you provide somebody. Sometimes, not in all cases. I mean, sometimes we need a pill, but you know what I'm saying.